we're not trying to catch an embryo usually at age 12, 12 and a half. And on average in the United States, we catch our first embryo at 26. And for those of us with more education, 35. So at least from 12 to 26, 12 to 35, why are we doing this every single month? And every time you build that lining, it could turn into cancer. And if people don't know already, by going on the birth control pill, patch, or ring for 5 years, you decrease ovarian cancer by 50%.
Welcome back to the Parenting Pair podcast. I'm Dr. Suzanne Allen.
And I'm Dr. Annalise Caron. And today we're super excited to have Dr. Sophia Yen join us to talk about her TED Talk and her very interesting perspective on possibly making periods optional. Imagine if that was a possibility for us back in the day.
Yes.
Right? But just by way of introduction and a little clarification about Dr. Yen, Dr. Yen is a board-certified pediatrician and adolescent medicine specialist with over 20 years of experience supporting kids, teens, families, really the whole lifespan. She's a proud MIT grad, went on to earn her official medical degree at UCSF and her Master's of Public Health at UC Berkeley. She now serves as a clinical associate professor at Stanford. Beyond her work with patients and students, Dr. Yen has been a true advocate for women's and adolescent health. She co-founded the Silver Ribbon Campaign to Trust Women and sheheroes.org. And she's also the co-founder in her free time of Pandia Health, which is about making birth control more accessible and stress-free. And we're going to be talking about that today. You might have also heard her, as I mentioned, giving her TEDx talk or come across her many academic publications where she continues to educate and inspire. We are thrilled to welcome you, Dr. Yen.
Thank you so much for having me here. I'm excited to chat today.
Yeah, well, thank you for coming on. I think we can just sort of jump into it for our listeners who may not have had the opportunity to already hear your TED Talk. If you could just provide a little bit of background of what led you and what sort of the thesis was of your TED Talk.
So my TEDx talk was a moonshot, and it starts with imagine a world where women don't have to be randomly hit by blood 1 week out of 4. How much better would life be? Yeah, and I also like to pitch as a tiger Asian mom from Silicon Valley. Is your young daughter going to do better on the SAT bleeding or not bleeding? In her sport, bleeding or not bleeding? On her final exam, bleeding or not bleeding? And looking back, I realized, imagine pre-med, MIT, biochem final, all of a sudden, bleh, and you're like, do I run to the bathroom? But anybody who's pre-health, you know the answer. You finished that exam.
You finished. Yeah, finished. And we laugh about it and we joke about it, but it is so true. I think people really underestimate how women are affected, by getting their periods, menstrual cramps, I remember personally myself missing school, the first day, some months, because I would have such terrible cramps and such heavy periods. Yeah. And people sort of blow it off as not a big deal, but that really, it's a stressor. You worry about it coming at the wrong time.
The anticipation of it and when it's going to come and what it might interfere with or where you might be or what you might be wearing.
Yes. Yeah, and it can be quite stressful.
Yeah,
for sure. So I love that imagination, of that possibility. And I think if you listen to your TEDx talk, you're really saying it is possible. And in fact, it's medically advisable. Is that your stance?
Exactly. So it's a risk-benefit equation, and the benefits outweigh the risks, in my opinion, unless, you have some other medical contraindication to making hashtag periods optional. So just to explain it a little further, I realized in getting pregnant with my first child, the only reason those of us with uteri bleed every single month is we build that lining. And we're like, embryo? Oh, no embryo. Bleed. And then we build it up again, right? And we're not trying to catch an embryo usually at age 12, 12 and a half. And on average in the United States, we catch our first embryo at 26. And for those of us with more education or took a while to find our significant other, 35. So at least from 12 to 26, 12 to 35, why are we doing this every single month? And every time you build that lining, it could turn into cancer, endometrial, uterine cancer. Every time you pop an egg, and we don't know if it's the popping or the healing, we feel it has something to do with the tubes, you risk ovarian cancer. And if people don't know already, the only way to decrease your risk of ovarian cancer is to take out your ovaries, which we do not recommend until end of postmenopause, or by going on the birth control pill, patch, or ring for 5 years. By blocking that egg popping for 5 years, you decrease ovarian cancer by 50%. And then lastly, I like to bring this up so that people understand the miseries that those of us with uteri have gone through. The intestine is around the uterus. And so as that uterus is going up and down every single month, the intestine's like, I'm sorry for you. And it either runs faster, diarrhea, or it runs slow, or constipation. And when you mess up the intestine or the colon, you increase colon cancer. So by decreasing this up and down, popping in the colon situation, you decrease ovarian, endometrial, and colorectal cancer.
I think that is so powerful. I think it's so powerful for parents to hear, for women to hear. Because I think whenever, particularly if we're talking about adolescents or young adults, when people consider medication, I think parents often have a lot of trepidation around it, and they have worries about, things being unnatural, or we hear, well, whatever the particular side effect or a certain population where this might be of concern, that gets blown up into, oh, well, this is unnatural, we shouldn't do this. But to think of ovarian cancer, which is so very difficult to treat and found so late, and endometrial cancer and these other cancers, that is not what's advertised. That is not in the common lexicon of how we understand a potential use for the birth control pill. And so I just think you getting that message out and really educating people is so very important from a public health standpoint. Mm-hmm. It's just huge.
Yeah, no, this is really my gift to the world, my realization. And as a feminist, I like to say I can do anything a person without a uterus can, bleeding. But as a doctor who has drugs and science, how about I help alleviate you from this, increased risk of cancer, as well as the number one cause of anemia in a menstruating woman is menstruation. And so I want everyone who doesn't menstruate out there to picture taking a knife and going and bleeding yourself 1 week out of 4. This was not natural. This is not what's meant to be. And so my OB-GYN professor at UCSF was like, the natural state of a female is pregnant or breastfeeding. How many periods you have when you're pregnant?
Yeah, you don't.
None.
How many periods you have when you're exclusively breastfeeding every 2 to 3 hours?
None.
And so to further hit this home, Dr. Beverly Strassman, she's a medical anthropologist, studies the Dogon tribe in Mali, Africa, and they die the same time we do. So we're not comparing people who die at 30 to people who die at 70, but we're comparing 70 years, 80 to 80. They have 100 periods in their lives. We have 350 to 400 periods in our lives.
Right.
Part of that is nutrition. As soon as you hit 100 pounds or 22% body fat, your body's like, oh, I can make babies. Let's make babies. And so they don't hit their periods till 16. We hit ours at 12. But more importantly, they have 8 children. Not saying we should have 8 children, but they have pregnancies and children. We have 2. And then they breastfeed for a year to 18 months. We breastfeed 0, 3, or 6 months. And definitely we should increase our breastfeeding. But the TLDR, they have 100 periods in their lives. We have 350 to 400. We have enough periods for 2 or 3 other women. We increase our risk of ovarian, endometrial, colorectal cancer. They don't have ovarian, endometrial, colorectal cancer because they aren't doing the up and down popping egg and colon situation every single month from 12 to 52.
And I think you've made a very compelling case there. I'm curious, though, just for the skeptics out there, could there be any other causal factor that might account for that you've thought of or that others question? I'm just curious.
I think the main concern is there is a slight increased risk of breast cancer, but more people die from ovarian, endometrial, colorectal cancer than from breast cancer. The good news is that we can catch breast cancer early and there's good treatment and most women survive But with ovarian cancer, as you stated, we generally catch it at stage 4, which means it's run through the whole body and it's too late, and it is very sad. And with science advancement, that'll be great. But also colorectal cancer. Your colon and your intestine is the size of a football field. And the longer you live, the greater the risk of something mutating in there and us not catching it and getting colon cancer. And so the risk of ovarian, endometrial, and colorectal cancer and the death rate from that is much more than that for breast cancer. So there is definitely a slight increased risk in breast cancer, but a family history of breast cancer is not a contraindication for the birth control pill patch ring or for HRT.
Yeah. So you answered the, unnatural.
Yeah, but I was also thinking, are there other concerns that you hear sometimes from parents or from young women themselves about, are there any risks or downsides to making periods optional? I can think about the things, I remember rumor, it'll make it harder for you to get pregnant someday if you use birth control. That would be one I definitely heard growing up.
Yes. So a lot of people ask, does the birth control pill patch or ring or the IUD or implant or shot make me infertile? And my joke is, while you're on it, because that's why it's called birth control. But for those of you who have taken the birth control pill patch ring or the IUD with hormone or the implant, as soon as that's out of your body, within a week, you get your period. And it's because the hormone was there and it was blocking everything from happening. And as soon as you take it out, and with the birth control pill patch or ring, there's 3 weeks hormone and then 1 week off if you want, or you can just skip this. That's the period's optional. But that drop in hormone signals a shedding, but that drop in hormone means the drug is out of your body. So with the pill, patch, ring, hormonal IUD, implant, pharmacologically, chemically, it is out of your body in 3 days. And if you want to be anal retentive, it has to be 3 half-lives. So maybe 9 days, or at the most 2 weeks, it is out of your body. The only exception is the shot, because the shot lasts for 3 months. And after like 3 shots, there might be some residual. And so with that one, it may take you 8 months to get pregnant. But most people can wait 8 months if they have to. Or if you really want to get pregnant soon, then stop 8 months. But that's only with the shot. All the other methods, 2 or 3 half-lives, which is 9 days, 2 weeks if you want to be totally, absolutely sure, out of your body. And then to reassure about this infertility, fertility, 2 examples. 1, they did a research study where they have 100 people on the birth control pill, 100 people not on the birth control pill. They waited 20 years, and then they took them all off, and they tried to get pregnant. 10% of each group had a hard time getting pregnant. It wasn't the birth control people had a lot more couldn't get pregnant. Each group had the exact same couldn't get pregnant. And that's not because the birth control made this group infertile and this group somehow infertile. It was because 10% of people born with uteri will get polycystic ovarian syndrome. And people with PCOS or PCOS, depending East Coast, West Coast, don't pop out eggs. And so, or have a hard time. And if you don't pop out egg, you can't get pregnant, or it's harder to get pregnant. So the difference in getting pregnant when you come off the pill is not that this made you infertile forever. This simply was, hiding it, or that both groups over time will develop polycystic ovarian syndrome. As we gain more weight, as we get older, there's a greater risk of PCOS. And then the other example I give is I gave a birth control pill talk to a bunch of infertility specialists. And I'm like, why am I giving a talk to a bunch of infertility specialists? Yeah. But people actually use the birth control pill to normalize the hormones in people with PCOS who can't get pregnant. So we use it to take their hormones and normalize it. And when they come off, that is the most fertile they're going to be. The longer they're off, the weirder their hormones get, and the harder it is to get pregnant. So this doesn't cause infertility. It's used for fertility, not while you're on it, but as soon as you come off, that is the most fertile you're ever going to be for a PCOS patient.
That's such an interesting and important point for that population. I'm curious then, when are the times? I imagine medically, there could be moms listening to this who have questions. Certainly all I can think of, back when I went on the pill, years ago when I was younger, was this idea of, blood clotting disorders. What are the circumstances when you might say, no, actually, I'm not going to recommend you consider making periods optional or going on the birth control pill? Who are those populations, and what should we know about that?
So part of it is realizing new versus old birth control pills. Back in the day, we started with 110 micrograms of ethinyl estradiol, and now we're down to 30 or 20. So we are 1/5 the dose of the original pill. So
Amazing.
1/5 the risk of blood clots. So blood clots aren't so much a concern if you're under the age of 35 and not a smoker. Luckily, much decreased smoker. Marijuana, not relevant, but not recommending marijuana till 30, 35 for your brain development, separate talk. So if you are a smoker or greater than 35, but you have to be both.
Right.
Or is fine, but both is not okay. But then blood clot disorder. So there are people who have a family history of blood clots in the chest and other weird blood clots. They get tested for protein S, protein C deficiency. Those are the two big ones. If you have a family history of that, please get tested. And if you have that, then no, you cannot have anything with estrogen in it. You could do a progesterone only method, such as the IUD with hormone or the implant or the shot, but not the pill, the patch, the ring generally. And then if you have lupus with a blood clotting thing, so there's the anti-cardiolipin antibody that increases your risk of blood clot. So not just lupus, but lupus with this blood clotty thing, then no. If you have liver cancer, no, because it's metabolized in the liver and we don't want to mess with your liver. And then migraine with aura, we're looking at that because with the lower dose estrogen, we're thinking that can go away, but it hasn't officially. So right now, if you have migraine, fine. But if you have migraine with aura, which is like before your migraine comes, you have some weird visual thing or part of your body doesn't move or something like that, that's migraine with aura or weird taste, then no, you cannot, because that's like a mini stroke, and adding some estrogen to a mini stroke could theoretically lead to a stroke. And we do not want that.
Yeah. I think your explanation and the risk reduction that is so significant for cancers feels like a very compelling reason for all of us to consider, hashtag periods optional. Are there other benefits to young people in addition to, an incredibly significant reduction in the risk of cancers?
Yeah, no, it's surprising that actually by going periods optional, having a stable hormone helps a lot of health conditions. So diabetes, seizures, headaches, depression, because going up and down, up and down, up and down every month was not what we were supposed to be. And by having a stable hormone that helps with diabetes, which goal is try to keep stable sugar, helps with seizures, because with seizure meds, we want to have stable hormones. And then acne is the obvious one. I used to get one giant zit every single month. I don't know if it was the popping of the egg or what, I can never remember back then. But as soon as I went on the birth control pill, there wasn't the popping of the egg every month. There wasn't the up and down of the hormones, and the acne got better. And during adolescence, you already have all the changes in your body, the stressors, the random blood hitting you 1 week out of 4. Let's get rid of the 1 week out of the 4 anxiety. Let's get rid of some of the acne. So the ethinyl estradiol increases this thing called sex hormone binding globulin. And this binding globulin finds testosterone and binds it, and then decreases your acne. So any of the birth control pills should generally decrease your acne. But the one random education point that you all get because you listened today is that there are 8 different progesterones. There are 2 different levels of estrogens. There's 40 different birth control pills. So if one doesn't work, there's 39 other birth control pills. Not all pills are made the same. And at Pendia Health, I've written 3,000 birth control prescriptions plus, but originally 3,000 birth control prescriptions over 2 years, and I saw all the different side effects. So I took all 40 pills and ranked them. Most likely make you bleed, least likely make you bleed. Most likely give you zits, least likely give you zits. Most likely give you munchies, least likely give you munchies. And then came up with Dr. Yen's algorithm based on race as a proxy for genetics, because we noticed that people of Asian, Black, and Latina had more of one side effect. Based on age, to make sure everybody should be on 30 micrograms of estrogen until 30 years old to make sure you have strong bones. If you go in and you're like, I want the least amount of estrogen possible, the doctor will be like, okay. And they'll give you the 10 microgram, the 20 microgram, because they aren't adolescent medicine. They aren't focused on bone health. And when you're 50, you're going to fall down the stairs and break your wrist, break your hip. And neither that doctor nor you will know that it was because you were on the birth control pill that was way too low estrogen. So you want 30 micrograms of estrogen till 30 years old, and know that I have an algorithm that we pick the best pill for you with the least amount of side effects. It's good for your bones. And with that, 93% of our patients are happy with the first pill we prescribe.
No kidding. But that it is so important to remember. I think, we run into this when we'll refer to psychiatrists for psychotropic medications. It's always having that knowledge in that patients that if possibly the first medication isn't the right fit, there are multiple options, and it is person specific. But if you're working with your medical provider to just stay the course, it sounds like you've really got an algorithm going, from your own, experience there to guide people in a positive way. But to have that patience is really important. I'm fascinated because I am 50 and I just got my first DEXA scan thing. And just what you're saying now, I'm going to make this podcast personal because I have Dr. Yen here. Why not? And I guess the whole world will hear this, but due to very heavy periods and very pain and missing a day of school when I was 8, through high school, when I was 18, they put me on the pill, and I stayed on the pill till I was 33 when I had my first child. And they gave me such compliments. In recent years, the last 5 to 6 years, I've done the weights and all of that, but I was not a consistent person that was doing sports and doing weight activities. And I was above the 50th percentile for my bone situation. And they showed me the graph of where I was headed. And I really wasn't headed for osteoporosis or osteopenia. Are you suggesting that it's possible that a factor that could have helped me in that is the fact that I took the birth control pill from 18 to 33? Am I understanding you correctly?
Yes. So we absolutely think you need 30 micrograms of estrogen until 30. And once the other part is now that you're 50, within 5 years of peri/menopause, your bone density goes. And so our company has now gone into menopause, and I'm a Menopause Society certified practitioner, probably the only pediatrician that's Menopause Society certified. But the estrogen is really key to your bone health. And so when your body's like, thank you for your service, and it takes away your estrogen, your bone density goes. And so I was like, if that happens when you take it away, put it back to maintain that bone. It is a drastic decrease that happens when your body takes away the estrogen. But certainly what I'm saying is that if somebody put you on 20 micrograms, that's too low and preventing you from getting that good bone density. And if they put you on 30, then they did good by you to make sure, because some athletes don't eat enough for the amount of, that they're running, or people of color, a lot of us are lactose intolerant and we don't get enough calcium. And so you need the estrogen to put on the calcium. You also need the calcium and you need the vitamin D. So if you are lactose intolerant, please make sure you're at our family. We have a calcium with vitamin D giant bottle from Costco in the middle of our kitchen. And if you didn't have calcium with breakfast, lunch, or dinner, you take a pill. But if you had milk with your cereal or your bagel, you don't have to take a pill. If you had cheese or you had yogurt, you don't have to take a pill. But 3 times a day, I try to get that in because I know we're not going to do it 3 times a day, but at least twice or once a day. Then, but I think, that's a practical thing. Get enough calcium and vitamin D from now until 30 because you're building up your calcium bank. And in order to build that, you also need to have enough estrogen. So if you're on the pill patch ring, don't go for the lowest estrogen. Now, don't go for the highest because that increased blood clot, but go for 30 micrograms minimum. So 30, 35 is where most pills are. But if you ask for a low dose, that's usually for the 40-year-old and up or 30-year-old and up that we can switch to the low dose. But when you're under 30, 30 micrograms.
I'm going to just allow what you just said there about perimenopause and menopause to be a little bit of a teaser, because Dr. Yen has been kind enough to say she will come back next week to answer some of our listener questions. So I'm going to follow up on that one next week. But I do have one other question for you before we wrap up for today, Dr. Yen. Is this, in your mind, sort of a recommendation that you wish would go to all adolescent girls? Is this something that's on a, need to know timeline? And is there, I think you did tip us off in your TEDx talk about this, is there a certain time that you consider starting the pill and a certain time that you wouldn't for adolescents? Just any thoughts on that?
Yes. So really, I feel this is my epiphany and my life hack. And my goal is to make those of us born with uterized life better and to even the playing ground. What I didn't mention about that exam is I look to my left, I look to my right, 2 people without uteruses. Not a care in the world. And I have 2 daughters, and I want them going into every exam, every sports, every performance with 100% confidence that nothing's going to hit them randomly out of 4. Or I had the retrospective epiphany that in every exam room, 1 out of 4 women is bleeding. Like, wow, we are amazing. So yes, I think this should be shared with anybody with a uterus, but also I wear this uterus necklace, and I love my dad, the feminist. He's like, we all came from the uterus. No one escapes the uterus. Respect the uterus. So the men should know too. My husband, my brothers, they know about periods. They know that I do not like them and they cause me suffering. My husband has bought me pads. My brothers will buy their daughters pads, and tampons, all of that. And so I think everyone should know about it. You did ask about timing. So
Yes.
I come from short Asian stock. And so if you aren't missing school, you aren't losing a ton of blood, then if you throw estrogen on too early, then it can fuse your epiphyses and you could lose potentially 1 to 2 inches, because after you get your period, you have like 1 to 2 inches of height left. But I met a woman and her daughter was like bleeding crazy and it hurt and she was missing school and her daughter was already 6 feet. So she was like, I'm fine. Let's turn this off, And so again, it's a risk benefit. If you are short people and it's not so bad, then wait 2 years. But if you are bleeding like stink and you are missing school, and know that I've seen people miss 2 to 5 days of school a month. And you'd be like, 2 days, that's nothing. But there's only 20 days of school a month. That's 10% of her education. And at Tiger Asian Mom, you lose 10%, that's an A-. And you miss anything else, you're at a B. So that is unacceptable in the Asian community. So 10% is not okay.
Well, and I think missing that also sets you up. I mean, I can very clearly remember missing school at certain times in high school. And, we work with so many kids in our local high school here. If you miss a day or 2 of school, the amount of makeup work, the amount of stress, that can set you back a week or 2. Because high school has gotten really hard. It's a lot harder than when I was there. Mm-hmm. So I think there's a lot of repercussions in addition to missing your education. I think it also can create a lot of stress and unnecessary anxiety for young people.
100%. This has been a really instructive and educational and helpful conversation. So we are super excited that you've decided to come back next week as well. But I think, for today, we'll sign up for here and really encourage our listeners to maybe speak to your doctor about, their thoughts about making periods optional and learning more, certainly going and finding Dr. Yen's talk, TEDx talk. It's on YouTube. It's very easy to find.
I've watched it a couple of times. It's excellent. So we would recommend that people go and watch that. If you enjoyed this today and are grateful for the information that Dr. Yen shared, which I know we are very grateful for this information and her expertise, if you could share this episode with someone that you care about, go online and rate and review it. That helps this podcast be more searchable and gets this information to more people, which would be an incredible asset to them.
Yes, and as always, we love hearing from you. Don't hesitate to reach out to us on Instagram at The Parenting Pair or by email hello@theparentingpair.com. With that, everyone, have a great week.